Hello my dear future nursing officers, welcome back to my channel. Without wasting your time, let's start. First question. Name the non-stimulant drug with norepinephrine reuptake inhibiting action used in the treatment of ADHD. Option A, atomoxetine. Option B, methylphenidate. Option C, dexamphetamine. Option D, Mhsrb. Correct answer. Option A, atomoxetine. Next question. How should a nurse administer an iron injection to an adult? Option A, intradermal in the forearm. Option B, subcutaneous in the arm. Option C, jet track intramuscular in the gluteal. Option D, intramuscular in the deltoid. Correct answer. Option C, jet track intramuscular in the gluteal. Next question. The expected height of a normal child at 12 months is option A, 45 centimeters. Option B, 75 centimeters. Option C, 50 centimeters. Option D, 100 centimeters. Correct answer. Option B, 75 centimeters. Next question. Increased depth of breathing with normal respiratory rate is called. Option A, Kusumal's breathing. Option C, orthopnea. Option B, bradypnea. Option D, hyperapnea. Correct answer. Option D, hyperapnea. Kusumal's breathing we can see in diabetic ketoacidosis patients. Next question. A nurse enters a room and finds a patient lying on the floor. Which action should the nurse perform first? Option A, assist the patient back to bed. Option B, establish whether the patient is responsive. Option C, ask the patient what happened. Option D, call for help to get the patient back in bed. Correct answer. Option B, establish whether the patient is responsive. Next question. The neural tube defect among newborns can be prevented by providing option A, iron to the mother in third trimester. Option B, folic acid to mother in first trimester. Option C, iron and folic acid throughout pregnancy. Option D, vitamin K to the mother in first trimester. Correct answer. Option B, folic acid to mother in first trimester. So, folic acid dosage is in pregnancy 400 mcg. We can start in before 3 months conception. Next question. What is hyperemesis gravidarum? Option A, morning sickness. Option B, excessive vomiting. Option C, lethargy. Option D, excessive loose motion. Correct answer. Option B, excessive vomiting due to HCl hormone increase. Next, which position is suitable for an unconscious patient while performing mouth care? Option A, Fowler's position. Option B, supine position. Option C, knee chest position. Option D, side lying position. Correct answer. Option D, side lying position because reduce aspiration. Next, Mr. Sharma developed features of depression after his divorce. Her divorce is considered as option A, precipitating factor. Option B, perpetuating factor. Option C, predisposing factor. Option D, personality factor. Correct answer. Option A, precipitating factor. Next question. A baby whose birth weight is 3 kg, what will be his required weight at the age of 4 years? Option A, 6 kg. Option B, 14 kg. Option C, 12 kg. Option D, 16 kg. Correct answer. Option D, 16 kg. Baby weight doubles in 6 months and baby weight triple times increase in 1 year and 4 times increase in 2 years and 5 times increase in 4 years. Next question. Which anti-tuberculosis drug causes poor vision and difficulty in color perception? Option A, streptomycin. Option B, ethambutol. Option C, rifampicin. Option D, paraginamide. Correct answer. Option B, ethambutol. So, side effect of the ethambutol is peripheral neuropathy, hepatotoxicity. Next question. The act of rubbing an oil onto the skin to produce a local effect is known as. Option A, injection. Option B, injection. Option C, inhalation. Option D, infusion. Correct answer. Option B, inaction. Next question. A 50-year-old man presents with sudden onset of dyspnea, breathlessness and chest pain. Examination shows tachypnea, hypotension, cyanosis, jugular vein distension, tachycardia and low-grade fever. The most likely diagnosis is option A, acute myocardial infarction. Option B, acute attack of bronchial asthma. Option C, stroke. Option D, pulmonary embolism. Correct answer. Option D, pulmonary embolism. Next question. While providing care to a patient with hepatitis, the nursing officer should take special precautions to. Option A, prevent droplet spread of infection. Option B, use caution when bringing food for patient. Option C, wear mask and gown before entering the room. Option D, use gloves when removing the patient's bedpan. Correct answer. Option D, use gloves when removing the patient's bedpan. Next question. The term aphakia means. Option A, inflammation of lens. Option B, enhancement of lens. Option C, absence of lens. Option D, lens disease. Correct answer. Option B, enhancement of lens. Inflammation of lens means we can call uveitis. Next question. The uterine fundus height of a pregnant patient is at the level of the umbilicus. Her pregnancy is about. Option A, 10 to 12 weeks. Option B, 20 to 24 weeks. Option C, 14 to 16 weeks. Option D, 30 to 32 weeks. Correct answer. Option B, 20 to 24 weeks. Next question. As a nurse, you are monitoring a patient in immediate postpartum period. You are checking TPR and BP every 15 minutes for first hour. Which value suggests you that there is an excessive blood loss? Option A, increased pulse rate 90 to 102 beats per minute. Option B, an increased respiratory rate 18 to 22 breaths per minute. Option C, temperature 100.2 degree Fahrenheit. Option D, none of the above. Answer, option A, increased pulse rate 90 to 102. Next, while assessing Mr. Gupta with Braden scale, the score attained was 8, which indicates that the risk of developing pressure sore for Mr. Gupta is option A, mild, option B, high, option C, moderate, option D, very high. Correct answer, option D, very high. Next question. What is the name of the opening that connects two atria of fetal heart? Option A, ductus arteriosus. Option B, ductus venosus. Option C, foramen ovale. Option D, ligamentum teres. Correct answer, option C, foramen ovale. Foramen ovale is after birth physiologically close within 5 minutes and functionally close it will take 1 year. Next question. In which of the following genetic condition karyotype 47XXY is seen? Option A, Down syndrome. Option B, Klinefelter syndrome. Option C, Edwards syndrome. Option D, Patous syndrome. Correct answer, option B, Klinefelter syndrome. In Down syndrome is a genetic condition, person born with extra copy of chromosome 21. So this means they have a total 47 chromosomes instead of 46 chromosomes. In this Down syndrome, physiologically we can see some signs: flat nose bridge, short neck and weak muscle tones at birth and small ears, hands and mental retardation also. And Edwards syndrome also genetic condition, we can call in other name of trisomy 18. So we can see in this condition physical growth delay. Okay, my dear future nursing officers, thank you so much for watching. We have reached 90k views with your support and love and affection. Once again, thank you so much. Keep supporting me and we will give you more videos for you. Without wasting your time, let's go back to our MCQs. Next question. Which statement among the following is true as far as maturation of Graafian follicles is concerned? Option A, maturation is influenced by both FSH and LH. Option B, maturation is only influenced by follicle stimulating hormone. Option C, maturation is only influenced by luteinizing hormone. Option D, maturation is only influenced by progesterone. Correct answer, option A, maturation is influenced by both follicle stimulating hormone and luteinizing hormone. Next question. What immediate nursing intervention will you take in case of blood transfusion reaction? Option A, inform the physician. Option B, inform the blood bank. Option C, monitor vital signs. Option D. Stop the transfusion and monitor the vital signs. Correct answer. Option D. Stop the transfusion and monitor the vital signs. Next question. As a staff nurse, you are caring a patient with psoriasis. Salicylic acid is prescribed to the patient. Which finding indicates the presence of systemic toxicity from this medication? Option A. Respiration decreased. Option B. Constipation. Option C. Tinnitus. Option D. Diarrhea. Correct answer. Option D. Tinnitus is correct answer. Next question. Phlebistotic axis is the point at intersection of option A. Mid-axillary line and line drawn through fourth intercostal space. Option B. Anterior axillary line and sixth intercostal space. Option C. Posterior axillary line and fifth intercostal space. Option D. Anterior axillary line and fourth intercostal space. Correct answer. Option A. Mid axillary line and line drawn through fourth intercostal space. Next question. Name of the receptor on epidermis that transmits stimuli to the axon through a chemical synapse. Option A. Langerhans cells. Option B. Merkel cells. Option C. Wurzer cell. Option D. Berger cells. Correct answer. Option B. Merkel cells. Next question. Administration of Mhsrb with a chemotherapy agent helps in option A. Favoring the destruction of cancer cells. Option B. Protecting the cells. Option C. Preventing formation of uric cells. Option D. Increasing production of white blood cells. Correct answer. Option B. Protecting the cells. Next question. Your patient complains of dry mouth with swallowing difficulty. Which among the following drugs can produce these side effects when administered in the above condition? Option A. Dicyclomine. Option B. Griseofulvine. Option C. Pyrantel pamoate. Option D. Naloxone. Correct answer. Option A. Dicyclomine is correct answer. Next question. Uterine polarity is option A. The neuromuscular disharmony between the two uterine segments throughout labor. Option B. The neurochemical disharmony between the two segments of the uterus throughout labor. Option C. The neuromuscular harmony between the two uterine segments throughout labor. Option D. The muscular disharmony between the two uterine segments during labor. Correct answer. Option C. The neuromuscular harmony between the two uterine segments throughout labor. Medical treatment of coronary artery disease includes which of the following procedure? Option A. Cardiac catheterization. Option B. Oral medication administration. Option C. Coronary artery bypass grafting. Option D. Percutaneous transluminal coronary angioplasty means PTCA. Correct answer. Option B, oral medication administration is correct answer. Next question. Which of the following causative organism is responsible for moniliasis? Option A, Candida albicans. Option B, Staphylococcus aureus. Option C, Tinea cruris. Option D, gonococci. Correct answer. Option A, Candida albicans is correct answer. Next question. 30-year-old pregnant woman is diagnosed with pulmonary tuberculosis. Which of the following anti-tuberculosis drug should not be given? Option A, isoniazid. Option B, streptomycin. Option C, rifampicin. Option D, ethambutol. Correct answer. Option B, streptomycin is contraindicated in pregnancy. Next question. A disorder of thought in which patient has a false and fixed belief that members of his family are trying to kill him is option A, delusion of persecution. Option B, delusion of grandeur. Option C, delusion of guilt. Option D, nail stick disorder. Correct answer. Option A, delusion of persecution. Delusion of grandeur means patient behave like he is a special person in the world, and nail stick disorder means patient thinks like there is no God, nothing else, and delusion of guilt means delusional belief of one's personal guilt for an event or real. Let's move to next question. Kernicterus, which may occur as a complication of jaundice, is a pathological condition of option A, liver. Option B, kidney. Option C, brain. Option D, heart. Correct answer. Option C, brain is correct answer. There is two types of jaundice. One is pathological jaundice and physiological jaundice. Pathological jaundice will occur within 24 hours after birth, and physiological jaundice after 24 hours of birth. Next, Monson's sign is a characteristic of advanced case of option A, keratoconus. Option B, strabismus. Option C, cataract. Option D, diabetic retinopathy. Correct answer. Option A, keratoconus. Keratoconus means cornea thins and gradually bulge outward in the cone shape. Eye disease that affect the structure of the cornea, resulting loss of vision. Next question. Rose Bengal test is used in the diagnosis of option A, brucellosis. Option B, whooping cough. Option C, byssinosis. Option D, bronchiectasis. Correct answer. Option A, brucellosis. Next question. Which of the following neurotransmitters is deficient in depression? Option A, only serotonin. Option B, GABA. Option C, only 5-HT. Option D, both options A and B. Correct answer. Option D, both options A and B. Only serotonin and GABA is correct answer. Next question. A patient receiving IV fluids develops warm tenderness, erythema and pain at the site. The nurse suspects which of the following? Option A, fluid overload. Option B, phlebitis. Option C, sepsis. Option D, infiltration. Correct answer. Option B, phlebitis. Phlebitis means inflammation of the vein. Let's move to next question. Station in obstetric pelvis is related to option A, iliac spine. Option B, coccyx. Option C, ischial spine. Option D, ilium spine. Correct answer. Option C, ischial spine is correct. Next question. Inflammation of tissues surrounding the nail is known as option A, clubbing. Option B, paronychia. Option C, chylonychia. Option D, onycholysis. Correct answer. Option B, paronychia is inflammation of the tissue surrounding the nails. Next, chylonychia means soft nails that have a spoon shaped like nails. Mostly we can see in iron deficiency people. Onycholysis means separation of fingernails or toenails. Next question. Name the neurological disorder characterized by the loss of the ability to execute or carry out skilled movements and gestures despite having the desire and the physical ability to perform them. Option A, anhedonia. Option B, apathy. Option C, apraxia. Option D, amnesia. Correct answer is option C, apraxia. Apraxia means is a disorder of the brain and nervous system which person is unable to perform tasks or movements. Next, anhedonia means patient inability to feel the pleasure. Next, amnesia means it is a memory loss. Okay, my dear future nursing officers, till now we have completed 600 plus MCQs. So, please watching for more important MCQs and please subscribe to my channel and like and share with your friends and don't forget to click the bell icon. We will meet you tomorrow in new session. Thank you.